I'd like to call to order a special city commission meeting for April 13th, 2021. We have roll call, please.
Commissioner Drosky. Commissioner Buda.
Here.
Commissioner Parnes.
Here.
Vice Mayor Preston.
Here.
Mayor Gann.
Here. If we could please have a moment of silence and our pledge of allegiance. Pledge of allegiance to the flag of the United States of America and to the republic
which stands nation under God,
indivisible,
with liberty and justice for all.
Thank you. We have approval of the agenda for tonight, April 13, 2021. Motion to approve.
Second.
Motion from the Vice Mayor, second by Commissioner Budak. All in favor say aye.
Aye.
Madam Clerk.
For those attending via Zoom online, wishing to speak on the item, please click raise hand at the bottom of the participants tab and your audio will be unmuted when you are recognized by the mayor. For those attending via Zoom by telephone, please press *9 to raise your hand and your audio will be unmuted when you are recognized by the mayor. Please make sure your audio is unmuted on your end by pressing *6. Thank you.
Thank you, Madam Clerk. Mr. Sherman.
Yes, thank you, Mr. Mayor. Anthony Soroka, City Attorney. Item number 1 is a resolution of the City Commission of the City of Deerfield Beach, Florida, approving a revocable, non-exclusive license to One Milo Inc. for administration of COVID-19 vaccines to eligible members of the public at the Center for Active Aging for a 6-month term with 2 additional 6-month renewal options, authorizing the city manager to execute the revocable, non-exclusive license agreement with One Milo Inc., providing for implementation and effective date.
Thank you. Mr. Santucci, I have a question. Is this organization going to be doing the Johnson & Johnson vaccines, or is it any?
No, this will not be the Johnson & Johnson vaccine, from my understanding. And I do have a representative from the company on the line after we go through a very brief presentation to answer any additional questions that the commission may have.
Excellent. Thank you. Go right ahead.
Okay, thank you. Heather, do you have that presentation? Thank you. And for this this evening's presentation, I'd like to turn it over to Ms. Donna DeFranzo.
Good evening, Mayor, City Commission, members of the audience. My name is Donna DeFranzo. I'm the Director of the Department of Active Aging. Here's a presentation regarding the vaccination site at the Center for Active Aging. Thank you, Heather. The purpose of this resolution is to approve and authorize and execute the revocable non-exclusive license agreement between the City of Deerfield Beach and One Milo Inc., based out of Miami, to use the Center for Active Aging building as a vaccination site to meet the needs of the residents in the community of all ages. Next slide, please. One Milo Inc. will provide a turnkey vaccination site at the Center for Active Aging. They will implement procedures that will be in compliance with the Center for Disease Control and Prevention, as well as the Florida Department of Health guidelines for vaccination administration. They will provide and operate a software platform and a dedicated website for required registrations and appointment scheduling for individuals that will be geared specifically for Deerfield Beach residents initially, as well as for the community as a whole. They will also provide a coordinated operations plan for the site set up with vaccination, securement, and vaccinations provided by licensed medical professionals, and they will submit all licenses and documents as required by CDC and the Florida Department of Health, not only prior to the vaccinations, but also post as it relates to one shot. Next slide, please. Right now, in the final preparations are in progress for this site location. The site location availability will be Monday through Friday from 8:30 to 6. Initially anticipated appointments beginning at 9 a.m. It is a 6-month agreement with 2 additional 6-month renewal options for the site location. It is recommended that the City Commission approve the execution of the revocable non-exclusive license agreement between the City of Deerfield Beach and One Milo Inc. so that we can provide vaccinations right here in the community from the Center for Active Aging for those that are interested in receiving vaccination. And we have Mr. Russell Lane here from One Milo to answer any questions, and certainly I'd be happy to answer any questions you may have.
Thank you, Mr. Lynn. Is he with us?
He is, Mayor. If I may just fill in just a few additional things. Mr. Lee was he came here to the city and he reviewed the site. We had some great conversation about some of the things that his organization can do for us. As was mentioned, this is a turnkey operation. We'll be providing some logistical support, facility support, but all in all, this effort will be completely handled by One Milo. And so we felt as though this was a great opportunity for the community. Now that we have vaccinations available at the ages of 18 and up, and in some cases 16 and up, depending on the vaccine, now is the time to strike and to service the community as the supply for the vaccines is starting to come in and more than what we saw originally over the past 3.5 to 4 months, when it was very tight and the vaccinations were only available for a small population. So we feel as though now is the right time to introduce this site and to take care of the community here that we have. Specifically, the Center for Active Aging was chosen because it is naturally a facility that has a component of healthcare attached to it. And additionally, it is it is located in a segment of our city that is historically underprivileged, and we felt that was a great fit. We looked at other locations throughout the city. We did contemplate the Oviedo McKeithen Recreational Complex. However, over the summer, we'll be having summer camp there, so we saw that as problematic. And additionally, if need be, as we look at some of our communities, or I should say our residential communities like the Palms, Praxis, B'nai B'rith, and the like, we have the transportation services there at the Center for Active Aging as well, who can provide transportation services for those communities should they need them. So without further ado, Russell, if I may turn it over to you, if you could just speak a little bit about your operation, I would appreciate it.
Hi, everyone. Thank you for this opportunity to speak to you today. I will start with just mentioning Johnson & Johnson, because it's the first thing that we're probably all thinking about and talking about today. So we do have Janssen, which is the brand name for Johnson & Johnson's vaccine, in our fridges, and we were vaccinating yesterday. We're scheduled to vaccinate Janssen in 2 locations today. And around 7:20 this morning, we put a stop on that, on the first notice that the CDC decided to put a pause. The initial message was that the CDC decided to put a pause on it and suspend using it. And they were asking the states to follow them as well. So as a private medical practitioner, clinic company, we obviously have to follow morally and in good medicine what the CDC was advising. The instance, we're talking about a 1 in a million chance of some sort of adverse effect, as I follow, but we expect the Janssen vaccine to be out of circulation for a couple of weeks now. Together with that, this morning, there was a story out on CNBC that they expect, similar to what we were expecting, and from our first conversations with you, that vaccine will become more readily available in the next weeks. And the expectation now is that in about 3 weeks' time, there'll be enough vaccine to cover all demand. In fact, even more so. So there'll be more vaccine than there is demand for it. So, that's a good opportunity for us to be in place to provide something that we've learned we've gained tribal knowledge over the last 10 months and been able to do. First, in our testing centers that we've operated for the cities, and now more recently in vaccine. I just, before I go on more about us and where we come from and what we're doing, I just wanted to possibly open it up to some questions so that will help me guide you on how I carry on. Is there any intermediate questions?
I see Commissioner Parnas, you have your hand raised.
Yes, we have places like a park here in Deerfield that is also vaccinating. What is the charge for your vaccination? I understand that people have to submit an insurance card of some sort.
Yeah. So, well, first of all, you can be guided to a website that we set up called deerfieldbeachvaccine.com, which is at the moment in your hands to approve and edit. That website clearly states out the eligibility of who gets vaccine and how much it costs. And no money, as far as the law as we understand it, no money changes hands at all. So if you have insurance, it's our legal obligation to provide it. If you don't have insurance, we bill the feds, the CARE Act. So it doesn't matter whether you have insurance or not, you get a vaccine and no money changes hands. We don't take 1 cent, we don't take any kind of payment. Anyone who arrives, all they have to do is show Florida the residency in some way. So they have an ID, a driving license, and that's perfect. But if they don't, there's 2 other forms of residency that they show. So we turn away almost no one, as long as you can provide residency, some sort of residency. And we sometimes work with patients, people will arrive and not have the right documents, and we hold a place and make, allow them time to get the right documents to prove their Florida residency. So that's all you need, and you get a vaccine. In terms of taking insurance and billing, what we understand, and I can share with you the CDC and Department of Health website for that. It makes no difference whether you have insurance or not. If you do have insurance and you don't use it, the CARE Act will find your insurance through your government ID. So your insurance company will be billed anyway. Okay. It's a $40 charge per shot that came under Biden. He changed it to $40 per shot. So if it's Janssen, it's one charge of $40. If it's Pfizer, it's 2 shots of $40. Okay. So that's how it works. And that's how we're being compensated for this project. It's really just the bill into the insurance company, or if you don't have insurance, it's bill into the CARE Act.
Thank you.
Thank you.
Okay.
Vice Mayor.
My first question is, how did we come to bring One Milo into this program? Is this a Florida state program that you guys are under? Because I saw that you guys are, I guess, based out of Maryland or somewhere. That might be it. That was said in the backup. So how did we get to you, one? And then we'll just answer that first.
No,
Russell, if I could address that to the Vice Mayor, because we were the ones that brought this agreement forward. Really, what we were able to find out, we mutually met at, like I said, out at the site. We found out they are licensed to provide the vaccines here in the state of Florida. They are registered in the state of Florida to provide the vaccines. So they have all the necessary infrastructure in place. But again, what we liked about One Milo over other options that we had was this is turnkey. Whereas if we were to go through the Department of Health and look to the Department of Health to put up a site, that's an extremely resource intensive endeavor. on the city because we are responsible for securing the necessary personnel to administer the vaccines, transporting the vaccines, refrigerating the vaccines, so on and so forth. So from our perspective, this was a great fit to make sure that we could, have a company who can come in, provide these vaccines, be very low resources on the city. And again, for 6-month initial term, we felt like that was a great opportunity to vaccinate the community. Does that answer your question, Vice Mayor?
By the way, we are a Florida company. We're 100% Florida company. We're all based here in Florida. The corporation was originally registered in Delaware, and that is because as many may know, Delaware has a long judicial record in corporation in corporate litigation. So there's a lot of law about corporations. So a number of corporations do decide to incorporate in Delaware, although they operate in their states. So we are registered in Florida as a foreign entity, but that's just the corporation. We were the technology we developed is based in Florida. We have a facility in Pompano Beach. We have an engineering lab in Deerfield Beach, and our headquarters is in downtown Miami. So I'm up the I-95, regularly going from Pompano to Deerfield, and in fact, we also have a small facility in Delray Beach as well. One Milo is a private company owned by myself and some doctors. Those two doctors own a chain of radiology centers in South Florida. So we're all Florida based, been here for many years. Let me give you just a brief history of One Milo, very, very brief. We were founded in about 2017, based on intellectual property that was developed in a lab in Pompano Beach. We acquired that intellectual property. It was a medical diagnostic system, and we realized we could bring new technology to that old technology and create an innovative way for medical diagnostics. We were recognized by NASA, and we were part of their accelerator working for astronaut health. We're part of a translational platform that what is good for 8 astronauts in space was going to innovate health for 7 billion people back on Earth. So it was translational technology, and we were part of that program. So about when COVID-19 was still something in China and not in the US, we realized we could make a COVID-19 diagnostic system. And we started working on that, thinking we were going to export it. And very quickly, it came here. So we kind of pivoted away from our core technology and started working on COVID-19 test, research, development, and manufacture in Florida of these tests. So we have a facility in Pompano that can make 1 million. So that's how, we are segmented in South Florida. So about last summer, a few cities in Miami-Dade asked us to not only make tests, but also provide testing services. So we very quickly started to do this for a number of the cities where we'd send a strike team, test the employees, the PD, public works people, and then also the community as well. And we started managing a drive-through testing centers. So we gained a lot of tribal knowledge in that. In so doing, we were licensed as a Florida healthcare clinic establishment. We're registered with the Department of Health to set up temporary vaccination, and we are a clear lab. Okay, so that's where we are.
Thank you, Mr. Lee. Appreciate that.
Yeah.
Go ahead. Mr. Lee, let's just say that there is not a release of the Johnson & Johnson vaccine that One Milo wants to use. What happens if there's a delay on that longer than you anticipated. Do you have a plan to switch to one of the other vaccines like Pfizer or Moderna?
Yeah, so the way Florida Shots and Department of Health works is that we put in a request for vaccine each week. So we already have a request in an order in for next week for 2,500 Moderna, 2,500 Pfizer, and we had one for 1,000 Janssen for Deerfield Beach, just for that location itself. So, you know, we've registered a number of pods. One of them is Deerfield Beach in anticipation of this. And we've already put in a request for those vaccines. And the idea was, before today, was that we'd give the population a choice. You know, we firmly believed 2 weeks ago, and I'm pretty sure I communicated that with your team, that we were nearing a point where all vaccine would become available. And I think that is, you know, based on the current press, we're getting much closer to that. So our idea is to give everyone a choice that when they log on to deerfieldbeachvaccine.com, they will use the vaccine once on any given day and come and arrive and get it. Okay.
Thank you, sir. To answer your question. Okay. Commissioner Goodine?
Thank you very much. First of all, Mr. Liddy, thank you very much for your time and choosing Deerfield Beach. Really appreciate it. Excuse me, the question I have is, I know that you're mostly a testing and research organization. How many other vaccination locations have you opened and are operating?
So we've set up 6 so far.
Thank you very much.
Thank you. I don't see any other hands raised. Is there anyone from the public care comments?
And we're in the process of setting up another 6, I guess.
Thank you, Mr. Lee. I'm gonna go to the public. Ms. Clark Reed. You have to unmute yourself, Quinn.
Thank you, Mayor. Good evening, Mayor and Commissioners. My concern is that.
I'm so sorry. I do need, as we all know, you need to your name and address, please.
Okay. Gwen Clark Reed, 1430 Southwest 6th Way, Deerfield Beach, Florida. My concern is that we have a pocket of residents, even though you say that you are going to be providing transportation, they don't have the means of getting online to register for the vaccine. How would they be accommodated?
Mr. Santucci.
The Center for Active Aging has been assisting residents with vaccination registration since January, and they will continue to do so for this site and other sites sponsored throughout the county.
Okay. Anyone else in the public? And close it to the public. For a motion?
Yeah. I have a question for you.
Yep.
How are we going to get this information out to the public?
Later on this week, we'll be meeting with the contractor, our public affairs and marketing team, Center for Active Aging folks and facilities maintenance. We will all be doing a logistics meeting, so we plan on pumping out this information through social media. We also need to alert the Department of Health of this site as well. So this information will be all over the place. I believe there'll be some marketing for One Milo as well.
Okay, I'm going to ask staff to keep in mind that in the African American community, a lot of people don't have access to social media, and so you have to really put forth an extra effort to get that information out there so that they know that the vaccine is available. As you know, disproportionately, the African American community is affected, and so this information is vital that this gets out. And sometime in the communication process, it's lost because so many people in the community are not on social media, they're not on the computer, and that matters. With that, I'll make a motion.
I'll second.
Motion in a second. All, I guess we need roll call on this one. Be a roll call, please.
Commissioner Drosky,
Yes.
Commissioner Hudak,
Yes.
Commissioner Parnas,
Yes,
Vice Mayor Preston,
Yes,
Mayor Gantz.
Yes. Mr. Lee, thank you very much, and we're really glad you were here. And again, on behalf of all the residents, thank you so much.
You're welcome. Can I make one last
Very
passing
quickly,
comment?
we're on to the next meeting. Yes, go right ahead.
Okay, so if there's any assistance that they need for underserved populations, we're always willing to help there. We can't access the system. We either they arrive at the center and we walk them through it and we check them in. Each day we do account for a number of walk-ins and availability of walk-in, but the idea to have a booking system provides a lot of dignity to patients that don't have to sit and wait for many hours in line. So it's a balance between making it available to everyone and also making a more orderly assistance, because we've seen places that don't require booking. People are waiting in horrible conditions for a long time, and we don't think that's dignified. So thank you very much for all your time, and we'll work with
Thank you,
anyone
Mr.
we
Lee.
can on underserved. Thank you.
Excellent. Really appreciate
All
that.
right.
I want to thank also Donna DeFranza and her team, who's done an outstanding job throughout this process, reaching out to the communities. Anybody that's called in and picked up the phone to actually call to inquire about it, directed right over her staff, did a fantastic job getting people registered, set up, and checked in on by them. So I want to thank you very much. Looking for a motion to adjourn.
motion to adjourn.
Second.
second.
All in favor, say aye.
Aye.
Adjourn. Thank you.